The Powering Through podcast is brought to you by National Cornerstone Healthcare Services, a subsidiary of NCHS Holdings Incorporated. NCHS is a full-service health organization which, through its affiliates, includes an accredited specialty pharmacy founded to serve people with hemophilia and other blood disorders and to optimize patient quality of life by providing personalized healthcare services in addition to pharmacy services. NCHS makes independence the goal for people with chronic disorders. They believe the home or an alternate non-clinical setting is the best place to receive treatments, which is why they do so much more than just fill prescriptions. Patients of NCHS can also expect medication therapy management, coordination of nursing services, and much more, including translation services for non-English speakers. Learn more about NCHS's services and the team who provides them by visiting nchswecare.com. Once again, that's nchswecare.com.
Everybody needs an advocate.
Because I'm not there 24/7.
Families that have hemophilia mature faster.
I've been feeling a lot of anxiety lately.
I'm so tired of being strong.
To understand how far we've come helps you appreciate where we are now.
No is just no for this person. Somebody's going to say yes sooner or later.
And it helps you understand that there are more steps to be taken in the future.
You're the first person I've met with a bleeding disorder.
Let's fight the disease and not the people who have it.
Hello and welcome to episode 7 of the Powering Through podcast, featuring panel conversations on obstacles, challenges, and what it takes to overcome, held for the benefit of the bleeding disorders community. The Powering Through podcast is sponsored by NCHS, produced by BloodStream Media, and I am your host, Patrick James Lynch. Remember to subscribe to the Powering Through podcast on iTunes, Stitcher, or wherever it is you listen to podcasts to have the most recent episode delivered directly to you. And you can visit poweringthrough.org to see videos, photos, and other podcasts from all of our Powering Through events. In this episode, we give a listen to a uniquely special Powering Through panel composed of 4 hematologists from the 4 hemophilia treatment centers, or HTCs, serving the greater Southern California community. This Powering Through conversation took place as part of the Hemophilia Foundation of Southern California's Family Education Day on May 6th of this year. And those 4 hematologists with us were Dr. Vanessa Luna Salinas from City of Hope, Dr. Nina Wang from the Children's Hospital of Orange County, Dr. Julie Jeffrey from the Children's Hospital of Los Angeles, and Dr. Doris Kwan from the Adult Clinic at the Orthopedic Institute for Children. We cover a lot of ground in this conversation, including recent trends and updates on topics such as the treatment of women with bleeding disorders and insurance challenges, chronic pain management and aging with hemophilia, the complex challenges of treating a multicultural community, updates on treatment products for patients with inhibitors, the challenge of understanding and tracking quality of life, combating the challenge of childhood obesity, and much more. One production note: I structure some of our Powering Through conversations more in the format of a talk show where one guest comes out, we speak one-on-one for a bit, then a second guest joins and we do the same, third guest, same, then all of us are in a panel conversation together. And other times, the format is more of a conventional panel because it better suits that particular event. That was the case for this panel. So it may be a little confusing to pinpoint who exactly is speaking from time to time, and I just want to encourage you that as you listen, while I do think the voices will begin to distinguish themselves, don't worry too much about which of these expert female hematologists are speaking. Focus instead on what it is that they are saying. We start with a question for Dr. Julie Jeffrey regarding von Willebrand disease and women with bleeding disorders.
What we're seeing is that there's so many women having a lot of bleeding, especially like heavy menstrual bleeding, and they can go what's on average up to 16 years before they're actually diagnosed with a bleeding disorder. So as you're looking through all of these people and realizing there's all these stories of women having big procedures like hysterectomies because they didn't know why they were bleeding, it was something that I wanted to start educating both our community, our patients, as well as the doctors who could then bring these women to our clinic so we could diagnose them.
I've heard women speak about having trouble getting reimbursed from their insurance or their insurance covering treatment related to a bleeding disorder because, well, you're a woman, you can't have hemophilia. And I know we talked a bit, Dr. Kwan, about insurance challenges and kind of the healthcare system being one of the greater obstacles to providing optimal care that you encounter. Can you speak a little bit about women with bleeding disorders needing to get coverage, but then coverage in general and how that presents challenges to you?
If you put on the diagnosis code as being a carrier for hemophilia, that doesn't really tell the whole picture. You may actually be symptomatic, and even that as a diagnosis code of being a symptomatic carrier really isn't enough to get that factor covered by the insurance company. The code that I think really should be used is mild hemophilia, because how do we define hemophilia? We define it as less than 1% factor level, or 1 to 5% as moderate, but truly, 5 to 40%. And if a woman who is a carrier has less than 40%, why should she not be diagnosed as mild hemophilia? Because that's how we're diagnosing it. I don't think I'd want to go to surgery with a 25% level. So yes, she's going to need some type of replacement, and stymate may not be enough, and she might need factor. And in cases of women who are delivering, if you know your factor levels are just borderline in the normal range, and you should have a dose of factor on hand just in case you have postpartum bleeding. And I think all those things should be covered by insurance.
I forget where I first heard it said, but the idea of treat the number, not the gender. If the factor levels are of a certain place, then that means the individual has mild, moderate, or severe hemophilia.
Yeah. In most cases, we say don't treat the number, but in this case, I think the number is important.
Agreed. Agreed. Dr. Wang, a question for you. Another segment of our population that sometimes doesn't necessarily get the same amount of attention are the older males with hemophilia. That was something that you emphasized, the need for pain management resources and development. Can you speak a little bit about that with regard to our older population?
One of the concerns I've seen a lot is chronic pain treatment, and which needs to be really addressed. But I think with the need of not being able to have access to good pain management that is familiar with hemophilia, that's a big problem. We're trying to get an actual pain doctor who will work with our team regarding that.
And Dr. Kwan, you too emphasized not wanting that older generation to feel left behind. And as an adult treater in particular, you probably have as strong a handle on what the needs of that population are. Can you speak a little bit to that?
They have had chronic bleeds that weren't treated. They have joint damage, arthritis, pain, and a lot of times with the bleeding disorder, they can't use some of the standard pain medications. So we do need to have some specialists that help our patients. And a lot of studies nowadays are showing that the opiate pain medications, long-term use, really doesn't change the pain. It covers the pain, and so that makes it tolerable for people to maybe go to sleep at night, but that doesn't address all the points of pain. And a pain management specialist, he can help attack the pain in different ways, because there might be nerve-involved pain, there's not just the bone pain, so there are other ways that they can treat the pain. And I think it's important to be able to work with that doctor and to get them to understand what the patients are going through. And so to have them part of the team, as Nina was saying, is really important.
What is one piece of advice you would give to a guy in his late 30s, late 40s, who's got a decent amount of chronic pain that he's dealing with, maybe isn't coming to the clinic, maybe isn't aware of all the different pain management tools that are available? What would be the number one thing to let that individual know about?
That the Hemophilia Treatment Center is there for them, that I think coping with a chronic disease is to not do it alone, that communicating with others is extremely important. And I think that's important for depression, as well as dealing with your pain, as well as your chronic disease.
The other thing we're trying to implement is more of an integrative approach, and I think at a comprehensive treatment center where you have multidisciplinary teams with physical therapy, with social worker, we have psychology, and we also are involved in an integrative pilot program and other programs that utilize acupuncture possibly, because that's not really been done a lot, but it can help. There's been some studies out there, but you have to use it appropriately and do it in the right setting. There's yoga, meditation. I mean, it's not just dependent on pain medication. There's a whole lifestyle and mental engagement that has to take place as well in order to look at the whole person. So I think if you're at a hemophilia treatment center, you're able to access not just giving factor treatment, talking to the doctor, but you can talk to the whole team with every aspect of your life.
With people for whom English is not the first language, there are often for any number of reasons, gaps in health literacy, health education, services that are provided. And you had a very, I thought, good point to make about how it's not as simple as language and translation. There's a whole cultural literacy component.
There is so many different languages, there is so many different cultures here, and we have to address, it's not just putting translator there, it's try to understand how that person who comes from a different culture sees their disease, sees the HTC, you know, how they're gonna, some patients are shy to ask for things. We need to tell them, you know, these are the things that you can ask for, these are the things that you need to know in order to treat yourself better, to know better your disease. So I always tell them, you know, you have to own your disease. Like to every patient, speaks English or not English speaking, they always have to own their diseases. So they have to understand as much as possible so they can know what they need and what they need to know what to ask. Now, talking about translations in different languages, sometimes they bring like a cousin or a brother or somebody who speaks English and they do the translation for them. In every hospital here in the United States, we have translators that are trained in speaking the medical language and translating the medical language. We offer that service. You know, there are especially trained translators that can take care of that part. That shouldn't be a burden for the patient. So that's very important. We like encourage the patient to ask for a translator. Don't be afraid to ask for a translator because that's the right for them. You know. In some cultures, is the doctor says this, that, and that's it. We cannot question the doctor, but you know, it's different. The more you know, the more questions you ask, is better for you. It's better for your family, better for your future. So we always encourage questions. We always, and you know, we see hemophilia patients since they're babies. So we try to make that connection to them, like they are open to ask anything they want. There is no bad question, there is no silly question. Every question is important because they haven't, you know, they haven't received all the information. Like we went to medical school and, you know, we keep training and getting more information every year, every month. There is always new information. So some of that information is very critical for some of the patients. So there is no bad question. There is always encouraging questions to our patients.
So we've talked a bit about women with bleeding disorders, von Willebrand disease, the adult males, people for whom English isn't necessarily a first language in advocacy. One other segment of our community that I want to talk about before we get into some broader HTC components is the inhibitor population. Inhibitors continue to be one of the most challenging aspects of treating hemophilia. We have between 20 and 30% of people with severe hemophilia at some point in their life wind up with an inhibitor. Dr. Jaffrey, the CHLA Hemophilia Treatment Center, we believe it's the biggest on the West Coast. It is a children's center. You have a lot of patients. I'm sure there are a lot of patients there with inhibitors. Can you speak a little bit about what you've seen and lately what's going on in the world of inhibitors and inhibitor management?
So, you know, to a hemophilia treater, inhibitors, you know, as Patrick said, are really our biggest challenge, and I think everyone here would agree with that. At CHLA, we do have quite a few patients with inhibitors. In a way, that's a good thing because, you know, all of us feel very comfortable treating patients with inhibitors at CHLA only because we see them so often, both the hemophilia A and the hemophilia B patients with inhibitors. You know, there is some new medications coming out, so for all of us that treat you guys with hemophilia, really in general, inhibitors or not, there's so many new medications out there. It's kind of really an exciting time for me and someone like Dr. Salinas, who just got out of training a few years ago, where we had, you know, maybe 5 or 6 factor products. Now we have so many more, and we're all trying to figure out what we do with them. But with inhibitors, really exciting, some big new changes are being made, and we're hoping that they work so well and so we can decrease the bleeding and increase their quality of life. Because if there's anyone in here in the room that has an inhibitor, you know that, yeah, the products out there, the FIBA or the Novo 7 work, But gosh, if we could just give you factor 8 or factor 9, it really works a heck of a lot better.
Lately, in the last 5-10 years, there are so many new factor A products. It's because of research, and the same is happening in inhibitors. So that's important part of belonging to an HTC. So the patients are aware of what other alternatives are for them out there. Part of research or coming new to the market, but is a way to participate in the hemophilia community, and that benefits to all of us. No, it doesn't benefit directly to our physicians maybe, but to the patients. So that's very important important part of the HTCs.
So staying on that track then, what other research is being done at any of the 4 HTCs we have represented here? Who all can speak to other research that's currently being done through the HTC? I know, Dr. Kwan, I know that there's a fair amount going on at Orthopedic.
Yeah, so we do a lot of the clinical trials, so the drugs that are on the sort of what Julie was saying, for the inhibitor patients, we're involved in those clinical trials. Some of the long-acting factors, we've been involved in those clinical trials, and not only with the products, but also with quality of life type of studies. We have people coming in, filling out pain questionnaires as part of a study, and to get to find out that 30% of the patients with hemophilia have depression, and it, like we said, contributes to having pain. So there are all kinds of the CDC study that all of us belong to. We're actually, grateful that all the patients out there are willing to participate, and I'd like to actually just take a second to thank all the patients that have participated in both these clinical studies with the CDC, those type of grants, as well as with the clinical trials, because without their participation, there would be no drugs for other people to use.
You've heard from NCHS about the services they provide to their patients. Now they'd like you to meet one of those patients, Joe. When Joe first moved to St. Louis, it was a bit of a shock. It's a big city, he was looking for a job. He didn't have much time to try to figure out his new insurance policy or figure out how he'd continue to receive his factor. Joe made a call to an NCHS rep he met at a conference, Kara, and Kara helped Joe get his coverage and his care in order. She ordered Joe's factor and made sure it got to him on the same day every month. She'd call to make sure everything arrived in order and check in on him periodically to make sure that he was keeping up with his care. Kara works for NCHS, the specialty pharmacy and healthcare organization, and this is what she does. She takes some of the hassle out of everyday life with a bleeding disorder. So, Joe was able to focus on his self-care without having to spend hours on the phone with doctors, pharmacies, or insurers. His factor and supplies showed up on time every month in the right quantities, and if there was ever a problem, he could just call Kara. She just made life easier. NCHS, we care for life. I want to pick up on that quality of life. Quality of life is something that I'm very interested in, and it seems like it's very challenging from a medical standpoint to pin down what it means, how you track it, what success looks like, how you can have services for it reimbursed. There's a cascade of kind of challenges with what quality of life means. It sounds like there's some research being done now or some studies being done now that are trying to help us better understand quality of life, but I'd love to hear from any one of your perspectives why, if you agree with me, why is it important that we have better systems in place to understand quality of life?
I always felt that your health was the most important thing in anybody's life, because really if you're not healthy, it's hard to be a good parent, it's hard to be a good sibling, it's hard to be a good child if you're feeling crummy. So I think for any of us, if whatever we're doing, pain medicine, factor, a hug, if that makes our patients feel better, that was the whole reason I think we did this.
I think also, quality of life is personal. It's what you feel is important in your life. For someone, a quality of life may be being able to go out there and play basketball and live as more of a normal life as possible. And for someone else, it's just being able to walk down the street. So it's, I think, being able to get an assessment of what's important to that person and being able to meet that goal. And I think at this age, we're very fortunate that here in California that we have access to so much different types of factor. We're able to support that. So being able to support their lifestyle and goals as they meet those things.
Well, and it's kind of staying on that topic of quality of life and how it is personal. Something that came up in our conversation before today was the particular interest that you have in childhood obesity. So again, talking about the different kind of segments of our community. For the younger members of our community, we know childhood obesity in the U.S. in general is a problem, but it's a problem that's particularly problematic if you have a bleeding disorder. So can you speak a little bit about that and what you're doing at the clinic to try to combat childhood obesity?
Yeah, I think that's part of our integrative medicine approach too, to be able to build programs, to talk about nutrition, to talk about exercise, trying to get people out there and being able to play sports and be active, and we're here to support them with factor that they need or other treatments to make that happen. And I think, diet and knowing diet and exercise and those healthy things do affect their bleeding and do affect their medical care.
And along those lines, it comes up often, I find, or people ask me, parents will ask me, my kid really wants to play basketball, or my kid is really interested in football, or is really interested in some kind of aggressive physical activity. And the first thing I always say is, I'm not a doctor, I don't have kids, I'm just a guy with hemophilia, I can tell you what's worked for me, I can give you an opinion, please don't go running with this, talk to a professional. But it does, I'm sure it comes up all the time in clinic visits when a child wants to do something that is, for lack of a better term, pushing the envelope a little bit in terms of physical activity. How do you navigate those conversations?
I think there is two sides. I'm a mother, and mothers sometimes were very protective. So there are some mothers that they don't want the kid to do anything, and it's not good for the emotional well-being of the kid to be raised doing nothing. Kids by nature are very active and they want to play and jump, and but for those kids who want to be involved with something, it's a lot of negotiation. We try to see, we offer the sports that are good for children with hemophilia, and try to see if they can get in, we can move the interest towards those sports. And if that happens, great, it's perfect. But there are other kids that if there is a lot of emotional component, there are kids that are going to get depressed because they cannot play soccer, or they drop the grades at school, or they start retracting for their friends. So there is a lot of negotiation, conversation, see what is going to be the best for the kid, because okay, he doesn't have a bleeding, but he's all depressed, so that's not good either. So I don't think there is a conclusive answer to that. It's case by case, it's family by family, patient by patient. Everybody's different. If we can choose what is the best for the patient, it's not only not having bleedings, but being also a human being that he's completely well, from mind, body, and soul.
And a lot of times I think we will, lack of a better term, negotiate with the patient. Okay, you really want to do this activity because you're going to die if you don't play soccer. And so you make a deal with the patient and say, okay, before soccer games, you need to infuse X. And that's the only way we'll sign off on you playing soccer. Or to participate in the practice, you need to use this amount, or you do your regular prophylaxis, and in between you have to infuse a little bit more because you practice every day. So again, it's just a negotiation, and you just have to find a happy medium. I know.
Be responsible, right?
Exactly, and then you have to be responsible and own up to it, because you've made the deal with your mom and your doctor, or your dad and your doctor, to do this so you can play this sport. And if you can't do it, then you may not be able to do that sport.
In terms of these new products and these new non-factor replacement therapies and gene therapy, how do we continue to make sure that the patient community stays educated and aware of this rapidly changing environment? Because there's some really big considerations to make with new classes of products that we've just never seen before. How do we continue to make sure that the education is out there so that people know what their options are?
Have them show up to more programs.
Show up to more programs, that's fair enough.
And I think, every time you go to the HTC, ask them what's happening. We could easily have a full clinic day, making sure your joints are fine, making sure you have enough factor, making sure you're not bleeding. And we may miss bringing that up with you. I know we don't make sure in every single patient that I update you on all the new products. So you ask us, you say, great, Dr. Jaffray, but what's new? What's happening? What can you offer me either this year, right now, or in a couple years, what's down the line? So then we can have that conversation.
I think there's families who are very comfortable with what they're on and it works for them. They're not bleeding. There's nothing new, so then they don't really feel like they want to know about the changes. I mean, it's still important to know, of course. So, but then we try to bring it up, but there's families that are more interested than others. So if you are really interested, agreed, definitely do your own research, go onto the website, find out about the different products, and then you can come to us and ask about them. We'd be happy to discuss them.
I'd love to just hear the little pitch from each one of you on why we need to support the hemophilia treatment centers and how important they are if you are someone affected by hemophilia, VWD, or a rare factor deficiency. Maybe Dr. Wang, do you want to start down there and we'll just go down the line? Essentially, why come to an HTC?
As I've mentioned before with the whole comprehensive model, I think that's really important, especially in treating hemophilia, but any bleeding disorder, to look at the mind, the body and everything along with it. The research is one that we've touched on, and I think having the research available at the hemophilia treatment centers, that we can better our treatment to optimize care and to be able to have access to the information, that the new things that are out there, because then that if you're at an HTC, you're having the doctors at the HTC and the staff at the HTC are going to these meetings, talking to each other, to other HTCs about the different treatments, how they're using it, because having that collaboration is important in overall.
I would say something that I don't think a lot of people realize is hemophilia, you do know, and all bleeding disorders, von Willebrand's, platelet disorders, is very rare. And the people up here are some of really the few who truly understand how to take care of you. And when we go through our training, we learn about how to treat leukemia, brain tumors, lots of anemias, and a little bit on the side, a little bit of bleeding disorders. So all of the doctors are not similar, and sometimes I even get scared in Los Angeles talking to other pediatric hematologists that aren't at one of our centers, and they just don't know exactly how to take care of you, and that really scares me. So I urge you to come to an HTC where this is all we do. We are all so passionate about it, and because there aren't that many of us, we know how to treat not that many of you either, and so I think it's really important.
Here we hear so much about hemophilia, bleeding disorders, so for us it's common. But there are pediatricians, they haven't seen one single patient with hemophilia during their training. So, and many, I'm sure we all have seen how they have misdiagnosis of hemophilia. So some kids have come with bad joints just because they were diagnosed so late, and that's a shame here in the United States, right? It's so education, but that's the reason we have hemophilia treatment centers, because hemophilia and bleeding disorders are not common. Not every physician in the United States have seen or have in contact, or probably they read it in a book and one time and that's it for the test. So that's why we encourage all patients with hemophilia and bleeding disorders to come to the HTCs. And it's not only the hematologists, we have incredible nurses, social workers, we have pharmacists, we have psychologists. It's just overwhelming, all the things that a hemophilia patient can have. It's not just a joint that is bleeding, it's not just replacing factor, it's the human being. We want our hemophilia patients to be, be able to develop normally, have a good quality of factor, if they want to do sports, if they want to study, there are scholarships that the Hemophilia Foundation offer. There are so many things that we know, and we only know it in the HTCs. Not other doctor that is not involved with an HTC will know that.
And I have to just echo what everybody else on the panel has just said. The HTC, the Hemophilia Treatment Centers, are a specialty. You don't want to if you have breast cancer, you don't want to go to somebody who treats lung cancer, right? That doesn't make sense. You need to go to the experts, and I think all of us here, we all do the same thing. We do bleeding disorders, and that's what we specialize in. That's where we attend the conferences to learn the latest and greatest. We have the clinical trials in place at all of our institutions. We have the experts, not only in the physician, but the social worker who deals with the bleeding disorders, the physical therapists who deal with bleeding disorders and know and understand the joints and what to do and what not to do. And the nurses are, the specialists in the bleeding disorders communities. The studies have shown that coming to an HTC has decreased morbidity as well as mortality, so it only makes sense.
Thank you again to Dr. Doris Kwan, Dr. Julie Jaffery, Dr. Nina Wang, and Dr. Vanessa Luna Salinas for taking part in this uniquely expert panel. Hard to overstate the amount of bleeding disorders expertise that those four hematologists share. Each of them made a great case for why someone with a bleeding disorder should belong to an HTC. Frankly, I think the entire panel conversation revealed how valuable it is to belong to that network. I do have one more reason that I would like to share, something that didn't come up on the panel, based on personal experience, and I will do that next, after a final word from our sponsor. NCHS believes in being a proactive partner in their patients' care, which means providing services like arranging convenient and discreet delivery, encouraging adherence to therapies, and monitoring your therapy outcomes. They also provide reimbursement services to help with navigating insurance requirements, which can be overwhelming for families affected by a bleeding disorder or chronic disease. And with a pharmacist available 24 hours a day, 7 days a week, NCHS can offer comfort to patients that someone will always be there when needed. Check out their website to learn more, nchswecare.com, or call 877-626-6247. Again, that is 877-626-6247. When I moved from New York to California in 2013, there were a bunch of logistical things I needed to figure out. There always are when one moves. Health insurance and care being a biggie. So, for reasons that I won't get into now, they're not important for this story, I did not belong to an HTC for the first few years that I lived in California. It's an experience that has helped me appreciate the value of HTCs even more so. So, last year I changed my health insurance so that I could join an adult HTC, Dr. Kwan's HTC, at Orthopedic Hospital, actually. Understandably, there were questions about my childhood with hemophilia, including questions about product use and regimens, questions that I just didn't have the answers to. But when it came up that I belonged to an HTC on the East Coast before my move to California, they said, "Oh, never mind then, we'll just call over there and have them send a copy of your file." That was a light bulb moment for me. I never thought about how this network of HTCs was just that, a network, with the ability for strong communication and cooperation in order to ensure the best quality of care for their patients. So, for any younger listeners out there, or older listeners out there who think they might move around a little bit as life goes on, keep that in mind too. When you belong to the HTC network, your medical care and history can move along with you. And that will do it for episode 7 of the Powering Through podcast. Thank you for listening, and we will be back next month with another great episode featuring another great conversation. Remember to subscribe to the Powering Through podcast on iTunes, SoundCloud, Stitcher, or wherever it is that you listen to podcasts. You can also stream our podcast episodes, watch videos of our conversations, and learn more about upcoming Powering Through events by visiting poweringthrough.org. Thank you, NCHS, for sponsoring the Powering Through podcast. Learn more about NCHS and their services by visiting nchswecare.com, where you will also find links to their Facebook and Twitter accounts. You can learn more about all of BloodStream Media's podcasts for the bleeding disorders community by visiting bloodstreammedia.com. This episode of the Powering Through podcast was written by Patrick James Lynch, produced and distributed by Andrew Gall, Patrick James Lynch, Avra Friedman, Colby Crow, Ryan Gielen, Rob Bradford, and Joshua Sterling Bragg. Artwork created by Ryan Gielen and Katie Wright Mead, and the Powering Through podcast is edited by Mr. Andrew Gall. My name is Patrick James Lynch, and until next time, take self-care of yourself.